Mom, Dad, it is important that you know how to help your teen manage his or her acne problem. And it is also important that you take his or her feelings about acne seriously. Is your teenager starting to get pimples? How to get rid of it? Well, the bad news is there's no cure for acne. But the good news is it usually clears up as one gets older. But in the meantime, we will talk about a few things that you can do to help your teen manage his or her acne problem. Helping your teen with his or her acne can make it less stressful for everybody. Hey, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. In this video, we will talk about what is acne, who gets it, what are the causes of acne, what can make it worse, and what is the treatment for acne. Acne. Acne is a common skin condition wherein hair follicles under the skin gets clogged. This is brought about by the clogging of the sebum, which is the oil that keeps the skin from drying out, as well as dead skin cells plug the pores. That leads to inflammation. So there's swelling, redness, pain, and heat, which leads to outbreaks of lesions, which we commonly call pimples. Most often, pimples are found on the face, but they can also be seen on the back and shoulders. So, who gets acne? Well, all races and all ages can get acne. There are more commonly seen though in teens and young adults. In teens, they are most commonly found in males. And when pimples continue into adulthood, there are more commonly found in females. What are the types of acne? Well, doctors refer to enlarged plugged hair follicles as comedones, and they are called whiteheads when plugged hair follicles are beneath the skin. But once the hair follicle has reached the surface, they are known as blackheads because the sebum is exposed to air, making it look black, not because it is dirty. Then papules are inflamed small bumps on the skin, while pustules or pimples are those with yellow or white pus with red base, while nodules are larger lesions which are painful and found deep in the skin. What causes acne then? Well, acne is a hormonal problem that is brought about by sensitivity to the androgenic hormones which become active during teenage and young adult years. It is the sensitivity to these hormones plus surface bacteria and fatty acids in the oil glands all combine to make one at risk for acne. There are some things that can make acne worse. For one, fluctuating hormones, for example, in a woman's period, can make acne worse. Also, pinching, popping, and picking at the pimples can make them larger, take longer to disappear, or it can scar. Also, clothing or headgear like helmets, for example, when they put pressure on the skin. Also, washing too often or use of harsh products may irritate the skin. Also, some makeup or cover-ups or hair grease can block the pores and make the acne worse. So, when choosing makeup or moisturizer, pick one that is oil-free or labeled as non-comedogenic or non-acnegenic. Stress can also make acne worse by increasing the stress hormone cortisol, which causes the acne to flare. Other things that can make acne worse are some medicines and genetics. How to treat acne? Well, before we go to that, do you have a newborn? Or You're expecting a baby? Well, congrats! How much better life can be when things are under your control upon baby's arrival. When you immediately feel confident about breastfeeding your baby. When you know how to soothe a crying fuzzy baby. When you know when to worry and call the doctor. When you know how to manage your sleep time because you understand your baby's sleep schedule better. When you understand about postpartum depression. I've developed an online training video series known as the 5 Newborn Care Strategies. Do check that out in the description section. How to treat acne. Well, in treating acne, remember, it does not go away overnight. It may take a while to unblock the pores. Realistically, it can take 6 to 8 weeks before you notice changes in your child's skin. So encourage your teen to be patient. Now, there are different types of medication. The most common is benzoyl peroxide. It is the most effective treatment without need of a prescription. It is effective in killing bacteria, unplugging oil ducts, and healing pimples. There are different brands and strength, and there are different types as well. They can be in the form of a wash, lotion, or gel. My advice to you is to start slowly at a low strength, like 5% lotion, for example, that you use once a day, and then after a week, you can increase it to twice a day. If it is not better after a month, you can increase the strength to 10%. If benzoyl peroxide is not working, there are stronger treatments available. One type is a retinoid, which is prescribed by the doctor. It is available in cream or gel that can unblock oil ducts. When you use this, be careful not to be directly exposed under the sun. It can cause the skin to peel or turn red. Another treatment is antibiotics that can come in cream, lotion, solution, or gel. These are mostly prescribed for those teens with inflammatory acne, such as red bumps or pus bumps. And the strongest treatment available is isotretinoin, which is taken as a pill. It is reserved for people with severe acne that has not responded to other types of treatment. Remember, since it is a strong drug, it should not be taken before or during pregnancy, and your teen should be closely supervised by a doctor. Here are some rules that we should follow when using topical medications or medications that is applied to the face. First rule, do not put on the medicine right after washing the face. It is recommended to wait at least 20 minutes. This would prevent dryness and drying and redness of the skin. Second rule, you do not need to use too much medication. Too much medication would lead to drying of the skin and redness as well. So, how to go about the right amount of medicine? So place a dab of medicine on your fingertip and spread it and put a dab all over the sides of your face, and then slowly spread it to create a thin coat all over the face. And third rule, you do not need to put the topical medicine on just the pimples, but to apply it to all other problem areas as well. And fourth rule, use an oil-free, non-acnegenic, non-comedogenic moisturizers for dry skin. Some tips for you in acne treatment. First off, be patient. Give each treatment time to work. Remember, it may take 6 weeks or longer to see changes on the skin, and 12 weeks to see maximum improvement. Then, be faithful to your treatment program. Follow your treatment plan and use it regularly. Also, follow directions. Not using it correctly can lead to treatment failure. And also, use only your medicines. Some treatment plans are created for a particular patient. What may work for your friend won't necessarily work for you. Also, don't overdo it. Using too much medicine or too much scrubbing can make it worse. And also, don't worry about what other people think or say about you. Be patient, and with time, your acne treatment will work. Hey, if you like this video, watch the next one where I teach you about other child health problems.